Hello everyone. Today our group will walk you through a comparative analysis of SARS in 2003 and COVID-19 in 2020, focusing on how each pandemic emerged, was recognized, and how Ontario responded. Both viruses came from the same coronavirus family, but the scale, impact, and the response was very different. SARS first appeared in Guangdong, China in late 2002. It came to Ontario through a 78-year-old woman returning from Hong Kong who passed away on March 5, 2003. In contrast, COVID 19 was reported in Wuhan, China in December 2019. Ontario confirmed its first case on January 25, 2020, in a man who had returned from Wuhan. So, while both started with international travelers, COVID 19 spread globally at an unreal scale. Within 2 months, Ontario had thousands of cases, compared to about 375 SARS cases during its entire course in Canada.
So let's talk about recognition and reaction speed. For SARS, Ontario's healthcare system didn't recognize the disease quickly. Toronto's first case was reported on 13th of March 2020. By then, several healthcare workers were already exposed. Hospitals were the epicenter, infection control protocols were outdated, and hospital acquired infection accounted for 43% of all SARS cases in Ontario. In contrast, with COVID 19, Ontario was on a higher alert, who declared it a public health emergency of all international concerns on 30 January 2020 and a pandemic on 11th of March 2020. Ontario declared a state of emergency on 17th of March 2020. Public health orders were issued faster than it was during the time of SARS, though this was without any confusion. Testing centers were rolled out, but contact tracing and early screening lagged, especially in the long-term care homes, which accounted for nearly 65% of all the COVID 19 deaths during the first wave. Now, Richa will continue from here.
Well, good morning, everyone. This morning, I've declared a state of emergency in the province of Ontario. We're facing an unprecedented time in our history. This is a decision that was not made lightly. COVID-19 constitutes a danger of major proportions. We're taking this measure because we must offer our full support and every power possible to help our healthcare sector fight the spread of COVID-19.
Back in 2003, the SARS outbreak really exposed some major weaknesses in Ontario's infection and public health systems. Hospitals did not have enough personal protective equipment, reporting systems were outdated, and communication between health agencies and government was all over the place. According to the final report from SARS Commission led by Justice Archie Campbell in 2006, poor coordination between agencies led to delays in decision making, something that made the outbreak even worse and put both healthcare workers and public at a greater risk. After SARS, the province took steps to make sure it would be better prepared next time. One of the biggest changes was the creation of the Public Health Ontario in 2008. PHO was designed to improve disease surveillance, support research, and provide expert advice during emergencies, basically, to help prepare Ontario respond more effectively to any future outbreaks. So, by the time COVID 19 arrived in early 2020, Ontario wasn't starting from scratch. There were better systems in place, more modern protocols, centralized data reporting, and a stronger public health network. But even with those improvements, the scale and the speed of the pandemic were very overwhelming. Many of the PPE stockpile turned out to be expired, and hospitals quickly found themselves at overcapacity, especially during the worst waves. When it came to the communication, the province stepped things up with daily press briefings, online dashboard tracking cases, and hospitalization. Clear guidelines on everything from social distancing to vaccines were provided. Still, some of the early messaging, like initial advice that masks weren't necessary for the public, led to the confusion and made it harder to build trust. And unlike during SARS, COVID 19 misinformation spreads really rapidly through social media, making it much harder for public health messages to stick and fueling skepticism and resistance.
SARS was serious but relatively short lived. In Ontario, 44 people died from this virus, and the crisis was largely under control within 4 months by July 2003. Despite the smaller scale compared to the later pandemics, the economic impact was significant. Toronto lost nearly $1 billion in tourism revenue, according to OECD. Now let's fast forward to COVID 19, and the differences are staggering. By 2023, over 17,000 people died in Ontario from this virus. The economic toll was far greater, reaching into the billions of dollars across nearly every industry, from small businesses to manufacturing and hospitality. Prolonged lockdowns forced schools to shift to online learning. Many lost their jobs, and the healthcare system came under immense strain. Frontline healthcare workers faced overwhelming workloads and high level of burnouts. At the same time, mental health challenges surged, especially among youth and seniors, a trend reported by CAMH in 2021 as a major consequences of pandemic. But unlike during SARS, COVID-19 sparked a wave of digital innovations. The crisis pushed Ontario to rapidly adopt tools that were barely in use in 2003. Virtual clinics, online classrooms, and vaccine passports apps became essential. These technologies helped keep vital services running through lockdowns and have continued to reshape how we access healthcare, education, and public services even beyond the pandemic.
After the SARS outbreak in 2003, Ontario took significant steps to improve its public health system and pandemic preparedness. Now let's talk about those. So, first one is Public Health Ontario, which was created in 2008 to centralize disease surveillance, improve public health policy, and ensure better coordination during health emergencies. The second one is Hospital Infection Control Protocols, which were updated to enhance prevention and minimize the spread of infection disease within healthcare setting. The third one was personal protective equipment, which was overstocked to prepare for future outbreaks. Through these supplies were occasionally neglected and some PPE expired before it could be used. However, when COVID 19 struck, it quickly became apparent that the province was not fully prepared for the scale or the speed of pandemic. One of the most significant area where this was failed was in long-term homes. According to the Ontario Long-Term Care Commission report 2021, early intervention such as better staffing and more protective infection control measures can be taken to save the lives. The report emphasized that many LTC homes were understaffed, lacked sufficient PPE, and faced severe challenges in managing outbreaks. Despite the lessons learned from SARS, not all the lessons were fully applied during the COVID 19 crisis. The failure to update tests and properly implement pandemic preparedness plans which left Ontario vulnerable. As the Commission put it, the key takeaway is that even the best plans are ineffective if they are not regularly updated, tested, and properly executed when needed most.
To wrap it up, SARS was the wake up call, COVID 19 was the stress test. Ontario improved a lot over the years, but cracks remained in the system, especially around care for some particular groups. Going forward, Ontario needs to invest more in preventative care, digital infrastructure, and rapid response mechanism. Because the next health crisis, it's not a question of if, but when. Thanks for watching.
Good evening and thanks for joining us. We begin tonight with drastic measures being taken to try to contain the outbreak of a mysterious pneumonia-like virus. Chinese authorities are effectively putting a quarantine on an entire city, cutting off Wuhan, where the potentially deadly coronavirus first emerged in December. Planes, trains, buses, subways, and ferries to and from that city of 11 million will be suspended tomorrow. The aim is to cut off transmission of the virus, but it is spreading. At least 17 people have died. More than 500 others are infected. There are now confirmed cases in South Korea, Taiwan, Thailand, Japan, and the U.S. There are no confirmed cases here in Canada, though tonight 5 people in Quebec who recently returned from China are being monitored. The World Health Organization has teams on the ground in China and is holding off on declaring a global health emergency for now. It's advising governments to be vigilant and ready to test anyone who has traveled to the affected region and has symptoms.